This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, waiting to take your phone calls. Love to talk to you on any subject they have in your mind. Matter of fact, you should call in because it's raining outside, so let's talk. Matter of fact, we have a topic that I think you're going to find very interesting. Why? Because it affects somewhere between 15 to 20% of the population. What are we talking about? Chronic headaches. You know, those things that make your head go boom in the night? Well, this is an opportunity for you to find out why, but more importantly, what you can do about it. Give us a call, 888-630-9625. That's 888-630-9625. Love to talk to you. My guest in studio, and to discuss this in an intimate fashion, the one and only, no other than the professor, Dr. Harlan Browning. Hey, Doc, good morning.
Good morning, Tom. It's excellent to be here. Always nice to start the new year off in the studio with you, and I think we have a good topic to do it.
Well, it's a great topic simply because, you know, after the holidays and people have indulged and they've done things that they shouldn't do, one of the products of that in the month of January is my head hurts. Why?
Yeah, certainly overindulgence of things that we shouldn't be eating too much of can trigger headaches. But, you know, we're going to talk about a lot of causes behind headaches. And the toxic part, that's what you just referenced, is definitely a piece of it. But there's a lot of other reasons that we're going to go into today. And certainly on Wednesday night, we're going to look at a wide spectrum of causes.
You know, the interesting thing, if people get into the web and they start researching headaches and so forth, get into either med.com or you can get even to Wikipedia or anything like that, you're going to see there's over 200 types of headaches, and they classify them into primary and secondary and so forth, and the majority of them are 80% primary, and then there's these other things. But the truth of it is, headaches can be broken down basically into two types. And one's what we call, neuromuscular contraction type of headaches, and the other one can be vascular, and those are the oddballs.
Right. You can have subspecialties within that too. I definitely look at muscular and the neurogenic that you referenced, vascular, definitely. Hormonal, that's a big one with the ladies. As their hormones shift during their cycle, it can induce headaches. So that becomes very important. We reference toxic, that's, when we eat things we shouldn't, or maybe we have too much alcohol. And then one of the most common ones that we don't talk about is referral. In other words, a site distal to where the headache is that's referring pain there. So we don't want to forget about that as well.
Now, let's start taking those a little bit one at a time and kind of work our way through the weeds, so to speak. This Wednesday evening, the 21st of the month, 21st already, January, it was just Christmas. What happened? And Dr. Harlan Browning will be your host, your presenter at the Roselle Center for Healing. The topic, headaches. And if you'd like to join us, all you have to do is call our office at 703-698-7117. That's 703-698-7117. Tell my staff you'd like to go. Remember, our in-house continuing education programs are a gift to the community. This is how we give back to you. There's absolutely no charge whatsoever. One thing is required from you, a reservation, so we know that you're coming and that we can prepare for you and make sure that we have the space available. We will do what we have to do to serve you. So give us a call, 703-698-7117. Tell my staff you'd like to be there. Dr. Harlan, let's go through the process. Let's kind of pick these things apart. I mean, we talked about hormonal headaches. They're vascular. They're migraine headaches. There are different types of migraine headaches. There's muscle contraction headaches. And you talked about headaches being caused by distal types of things, which can be visceral, like gallbladder problems and liver toxicity and so forth, which I was alluding to when we first got on the program today. How do you distinguish? Patient comes in and they tell you, I got a headache, doc. I can't stand anymore. I've been on drugs. I've been taking all kinds of medications. Nothing seems to work. I take too much medications, and I'm a zombie. I can't live this way. Well,
I look usually at 6 factors. What's the location of the headache? Is it in the front of the head? Is it on the back? Is it the side? Is it the whole head? In totality. What's the intensity? Is it a 0? Is it a 10? Is it somewhere in between? What's the time of day? How frequent do you get it? what makes it better, what makes it worse, and then what I call autonomic concomitants. Do we have a headache and are we nauseous? Do we have a headache and are we dizzy? Do we have a headache and we feel something else going on? So if you look at all of those 6 factors and you tease them apart, you can put a person in a category that gives you a better understanding of what you need to do to fix them.
How about the patient that comes in and tells you that, I wake up every morning, I've got a headache, and it's miserable. I get up, I walk around, I have a glass of water, within an hour it's gone, doesn't come back again till the next morning.
Well, the first AM headaches, if they're in the back of the head, the first thing that I think about is they're either using the wrong type of pillow, too many pillows, or they're sleeping on their stomach. They're getting their neck in a position that's causing either irritation to the muscles in the back of the head or it's causing nerve compression. And, those nerves are going to fire off and it's going to cause headaches. If we're getting it in the front, specifically over the eyes, and the person gets up, they move around, it gets a little bit better, I start thinking gallbladder, I start thinking thyroid. If the person certainly is cold a lot, then I'm starting to think thyroid even more. So I like to look at the location and then what other factors are causing their problem.
I don't know why it stuck with me, but over the years, one of our professors, and you and I went to the same professional school, National University of Health Sciences in Chicago, and I remember this one day we were talking about reflexive patterns and representations of thyroid problems, and he said, anytime a patient walks in and he tells you or she tells you that they have a headache that resembles a hat band in the morning, first thing, right around the head, narrowed, compressed type thing, and they get up and move around and goes away, it's always thyroid until proven otherwise.
Yeah, and there's sometimes it's those subtle little signs that are going to point you into changing your thought process. Not all headaches are a migraine or a tension headache. It can be caused from, metabolic things, certainly thyroid being one of them.
How about the patient that, gets up in the morning, has this dull, lousy headache, they can't focus and so forth, and they tell you that they wake up repetitively during the night?
Well, if they're waking up at the same time each night, we might want to reflect on the acupuncture system and specifically the 24-hour clock as it's represented in acupuncture. So if a person is waking up consistently at 1 o'clock or 3 o'clock or something, maybe it's the lung system, or maybe if it's earlier in the morning and they're waking up at 4 or 5 or something like that, and we might want to look at one of the other systems as being contributory to their problem.
One of the things I find extremely interesting is the patient that comes in and they tell me that they can't sleep. I ask them, can you get to sleep, and then do you wake up, or do you just can't get to sleep and you're up all night long? And then I have to ask them, whether or not their mind just won't shut off, or if it's just no, I just can't sleep. And the interesting thing with so many patients, particularly in this environment, is that we either are eating a diet that is so high in carbohydrates and so low in protein, or we're eating so early, even if we're eating well, and we're going way too long without any food in our body, so they start waking up.
Yeah, so as the blood sugar drops, it's the autonomic or the automatic system of the body that's responsible for telling us to release stored energy. So we're going to do that by tapping into the liver and muscle stores of glucose. But if we don't have much in there because we don't eat properly, then the body is going to try to wake itself up to tell it needs to do something. It needs to feed itself.
888-630-9625. That's 888-630-9625. Love to talk to you. We're talking about headaches, but we'll talk about anything that you'd like to discuss with us. Dr. Harlan Browning, my guest in studio, the professor, will be speaking to you on the topic of chronic headaches this Wednesday evening, 7:30 at the Roselle Center for Healing in Fairfax. Join us. Love to have you as our guest. Give us a call at 703-698-7117. That's 703-698-7117. And just as a little tidbit, if you'd like to see what it is that we do at our center this afternoon at the Angelica Film Center in Maryfield, Virginia, we're going to be showing the 2-time Emmy Award nominated PBS special, Ageless Health, the special. And it's about 6 patients who had gone everywhere, done everything and tried all kinds of allopathic and traditional care and had failed miserably. They walked in, they were on all kinds of medications, and each one of these patients, all 6 of them, one was MS, another one was ADD, ADHD, another one was a master's level tennis champion who couldn't hold on a racket, a fireman with back pain who had been everywhere, a young lady who had such severe allergy reactions that she would go into anaphylaxis and seizures almost daily. These are people that had no hope and found a full resolution of their problems, and to this day they have not come back. Why can we show it to you? Because now PBS no longer owns it as of last month, and this program will go throughout the country in a lot of different communities. We're offering it. It's a fundraiser for Caring for Others. Caring for Others is a 501c3 Virginia-based charity. Dr. Browning is in the presentation.
I am, and it's actually what the patient had, headaches, so that's very specific of what we're talking about today.
Exactly. And he had TIAs, transient ischemic attacks, what they call mini strokes. It's basically vascular occlusion. So if you'd like to join us, 2:00 at the Angelica Film Center in Merrifield, $10. That's all it's going to cost you. And by the way, it's a full tax deduction. We'll give you a receipt because it's a 501c3 donation. You get to write the whole thing off. 2:00, Angelica Film Center. Join us. And then this Wednesday evening, Dr. Harlan Browning, intimate with you one-on-one at the Roselle Center for Healing. Join us. Call 703-698-7117. Let's get into the mix a little bit, and let's kind of differentiate these things. I became a chiropractor and stayed in chiropractic, even though that I was accepted in medical school, because of my wife and her migraines. Sue had migraines from the time she was 6 years old, and they got progressively worse over time, to the point where it truly would wipe out 2 days out of every week, and either the medication or the migraines. Finally, when she was about 23 years old, they told her that when the pain got so bad the medication had no longer an effect on it, they would do a cervical fusion. They would fuse all the bones in her neck to stop the irritation and so forth. So I said, no, I don't think so. So let's see what we can do. And we started in a clinic in Elgin, Illinois, and straight structural treatment, and her headaches went away within 30 days, and she had to stay under care to correct the problem, just like you would correct an abnormal bite with braces. And all these years later, it's never returned.
Yeah, and sometimes we assume that if we're getting migraines, we're always going to assume it's the worst thing ever. It's a brain tumor or something that can't be treated. But the fact is, most of the time, people are having headaches for very common reasons that are very treatable. So I hear stories like yours all the time. Patients come in and they'll say, I've had migraines, I've had tension headaches or what have you, and I've been to everybody. It's not going away. And I'll ask them the simple question, well, have you ever been treated by a chiropractor? And they're like, no, I've never thought about it, but here I am because I have no other options. You treat them, they get better, and the pain goes away, and then they, inevitably say to you, well, I should have done this 10 years ago.
Yeah, I would have lived all these years in a much better place than I do now. And, here's the interesting thing, because I've had conversations with medical physicians and so forth. They said, how could that be? How could you get rid of a migraine with manual manipulation? And I said, by definition, a migraine is a vascular headache. It's a blood supply headache. Well, at the back of the neck, you've got two arteries that go through the bones of your neck called the vertebral arteries. They're named that way because they go through the bones, the vertebrae of the neck. They come together at the base of the brain called the basilar artery, and it supplies the posterior portion of circulation to the brain. So this is where all your automatic stuff takes place. So when Sue had these headaches, they would always happen on the weekend. Why? She was one of these Class A drivers, one of these people that, put more time in her academics than I think I did my entire career. She did it in about 6 months. But anyway, she would work, and then on the weekend she would take a break. So she would relax. All the muscles would relax. The blood flow had been crimped before that, and due to the malposition and the muscle contraction, and now on the weekend she would relax. Here comes the blood supply. The arteries in the brain are not prepared to receive it so quickly, and now the expansion of the blood vessels within the brain caused the headache, and that's where it came from. We're coming up to a break. Dr. Harlan Browning, my guest in studio, your host this Wednesday evening at the Roselle Center for Healing. He's going to be talking about headaches, migraines, toxic headaches, all those things that all of us suffer from. Unfortunately, well over 15% of the population suffer from chronic headaches. It's an opportunity to find out how to get rid of them. We'll be right back after some important messages. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live in studio. It's raining outside, but it's sun shining in the studio because we're giving you all kinds of stuff that you can use to help yourself. What are we talking about? Headaches, all 200 and some odd different types of primaries and secondaries and muscle contraction and vascular and chemical-induced and visceral-induced and you name it. It just goes on and on. But you have to distinguish the difference, because if you don't know what they are, then you go to your doc and he says, take these pills, call me in the morning. And that's not okay. You need to figure out what it's all about. In studio, Dr. Harlan Browning, who will be your host, your presenter at the Roselle Center for Healing this Wednesday evening, the 21st of January. Already. 7:30 p.m. Love to have you as our guest. All you got to do is call us, 703-698-7117. That's 703-698-7117. If you'd like to meet Dr. Browning before you hear him talk, actually you might hear him talk as well if he comes this afternoon, we are going to have the pleasure, the opportunity, the prideful presentation of showing you the Ageless Health movie at the Angelica Film Center in Merrifield, Virginia. Be our guest. It's 2 o'clock. We're going to introduce the film, and we're going to show you the film. It'll take an hour, and then I'm going to answer questions. Dr. Browning is going to answer questions afterwards. $10, donation to Caring for Others, 501c3, so it's a donation. You get to write it off. What better? And it's raining outside. It gives you the chance to stay inside and have some fun and learn something and meet us and, really get involved in your own health. That's this afternoon at 2 p.m. So join us at Angelica Film Center. Wednesday night, Dr. Browning, he's the guy. He's going to be the platform presenter at the Roselle Center for Healing. Love to have you as our guest. Let's go to the phones. Bernice, you've been very patient and sitting there. How can I help you?
Oh, I have a question about the foot baths. A friend of mine said she used the foot bath and her headaches went away with it. What's the how does it work?
That's real simple. It's an ionization. It means what it does. You've seen these foot pads on television, right, where they put them on the bottom of your feet, and then the next morning they show you the commercial, they turn black.
Oh, yeah.
Okay, That's like 1/1000th of what the foot bath does. So you put your feet in water, and then you put this electrode in the water with the feet, and then you have a wire that goes to a transformer. And when you turn it on, the technician will put a little bit of salt in the water and read numbers until the numbers get to a place where it indicates that the permeability of the patient's skin and the permeability of the water are the same. So then the transformer sends a signal to the electrode that it starts grabbing positive and negative ions. So anything that's unattached, poisons, toxins, inflammation, have positive and negative charges, and they'll go back and forth and grab these things out. So it pulls it out and dumps it into the water and so forth. So you've got these inflammatory particles, these toxins that begin to pool outside the body, and the lymph system is dumping. Now, I'm giving you a very thumbnail explanation of it, but that's how it works. And the process continues. You've got to drink a lot of water because when you get home, your lymphatic system is still clearing, and we have our patients go home with bags of Dead Sea salt, and they do 3/4 cup of Dead Sea salt in a tub of water, and it helps take this stuff through the skin as well. There's a whole series that should be done with this, and you can use a low-energy light laser in addition to it to trigger the release of very specific substances. So if we have a patient who has toxic whatever, we can set it. We want to get rid of lead. We want to get rid of arsenic based on blood tests or based on urinary challenges or based on hair analysis. We can pull those things out, and we could talk about it. Anyway, that's the simple answer, Bernice. So,
how often should you do those?
Well, if you're doing a series for a specific reason, you usually do them twice a week for up to 6-7 weeks. Then you take a break for a couple weeks and let the body reset itself, and then you can continue it again for maybe once a week. I do a full series at least once a year, and then periodically, if I'm feeling sluggish, I'll jump in and I'll do that with some detoxifiers. So you can do it. Depends on patients who have headaches, particularly. They have high levels of inflammation in some cases, particularly when it's a toxic headache, something due to exposures or environmental stimulants, and you can pull that stuff out, and it makes a huge difference. The recovery rate is much, providing you change the reason that they're being exposed to it to begin with. If you don't change that, then they continue to have the problem.
Can you use that when you got inflammation anywhere else, like, let's say, sciatica or somewhere else?
It'll help. It'll calm it down, but there are other things that are better.
Oh, okay.
Bernice,
all right. Well, thanks.
Thanks for calling, hon. Take care of yourself. 888-630-9625. That's 888-630-9625. Dr. Browning, real quick, since that was the topic, we got a minute before we have to break. Talk about the inflammatory reactions that she was talking about.
Well, inflammation is certainly a big culprit when it comes to any kind of pain. You could look at it certainly with headaches. So when people take Advil or naproxen or those types of things and their pain goes away, then we know we have an inflammatory situation in place. You got to ask yourself what's causing the inflammation. Is it being caused by local irritation? Okay, could it be the muscles that are being irritated because they're being stretched or compressed? Is it the nerve that's doing that? Is it a systemic inflammation? Is a person's diet very poor, that they're eating lots of refined carbohydrates, sugars, alcohols, all those types of things? Is that shifting their pH?
So real quick, yes or no? Does chronic pain over a long period of time, we know that causes inflammatory response. Until it goes away, the inflammation doesn't go away.
Very often it doesn't.
We're coming up to a break. We're talking about headaches and the things that make you miserable. We'll be right back. Don't go away now.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. It's raining outside, but we're having fun. So join us. We're going to talk about headaches this Wednesday evening, the 21st of January. 3 weeks in already. This is like it's going faster and faster. I used to laugh, Dr. Browning, at my father and everybody else. And, in the summertime, you sit around, I can't wait till. And they used to look at me and say, don't wish time away. You're going to wish that you had it back.
Yeah, so as you get older, and we're both getting older, we want some of that time back, so we got to use it now.
Bite your tongue, man. You may be, but I'm not. We both have that, that lightening of our hair coloring.
Lightning. I'm pretty silver. I don't know about you, but
because I don't.
I got a little bit more hair than you do, but it's definitely grayer.
Now we're getting personal.
Okay.
888-630-9625. This Wednesday evening, Dr. Harlan Browning is going to be talking about headaches and all the different types of headaches. So if you've been taking medications, you've been suffering from headaches, your doc says take these, it'll go away, or be on these things for the rest of your life, this is an opportunity to figure out how you can get off of them, maybe permanently, and never have a problem again. You have to find out the why is that behind any situation. If you can identify the why, you can fix it, it goes away. Dr. Browning, when a patient comes in with a headache and they say, I have headaches all the time. And they tell you, well, it's here and it travels. It goes from one side to the other, to the top, whatever. It's non-specific. They say, what's the character? They say, well, sometimes it's dull, sometimes it gets really sharp, sometimes I get dizzy with it. What does that tell you? How do you go from there? Because that happens a lot.
One of my clinicians told me something that was pretty profound. And you've heard this before. He said when you hear hoofbeats, you think horses, not zebras. So I always start with the most common things that cause headache patterns or migraine patterns, and I look at the structural causes, I look at the chemical causes, I look at dietary patterns, and I just look at a person's overall health. Very often when we work with a patient, and it could be a headache problem, it could be low back, it could be digestion, what we're really doing with that person is just getting him healthier and allowing the body to do the healing process. So you start with the real basic components of it and work yourself backwards. Most of the time, like I said before, the headaches are caused by a few things. It's odd for a headache to be caused by something that's rare.
What's a cluster headache?
A cluster headache is usually something that's localized on one side of the head. It's usually pretty darn intense, more common in men. I don't see them too often. I think people get diagnosed with them a little bit more than they should. It's one of those things it's a thunderclap type headache that just hits them and the person, it just knocks them down. It's probably one step higher when it's truly a cluster headache above a migraine as far as pain's concerned.
888-630-9625. That's how you reach us here, and how you register for the class this Wednesday evening is 703-698-7117. We're talking about headaches and the different types. Cluster headaches are one of those things that, as you said, affect guys more than women, and it doesn't seem to be, at least it used to be. And that's the point I wanted to bring up. We're seeing more and more of it in women today, even though that they represent a small piece of the total headache presentation of the different types of headaches. Guys years ago were the drivers. They were the hunters. They went out. They fought in, the battlefields, and they chased tigers. Now in the workplace, they did the same thing. They got a boss that's biting at them. They're under the wire to produce. Now women You know, you've got to be careful, ladies, what you ask for equality, because now you're in the workplace and you have to work the 75, 80, 85-hour work weeks. You're catching as catch can. You're drinking, you're eating, you're gnawing, you're clenching. And all these things can trigger that type of headache. Particularly, it's a one-sided type of problem. It's usually on the head, and as you said, it comes and it is relentless. It just gets a hold of you and it wants to drop you. A lot of people have suffered so badly that it's one of the conditions, along with trigeminal neuralgia, that people have actually committed suicide from.
And I think it's important to look at when we see a headache being more common in males versus females. My default is, what's going on with their hormones? Are their hormones balanced, or is there a relative imbalance? Is one too high and everything else is low, or is everything within the normal range and one is too high? So you always need to consider that. There's tons of exposure to estrogens in the outside world. We call them xenoestrogens, from plastic, from the water that we drink, from all types of things. So if we see something more common in men versus women, or vice versa, I always think about what's going on with their hormones.
Yeah, the estrogenic effect today is broad-based. We were talking, a few weeks ago about the amount of estrogenics in the water, in the atmosphere. It's affecting men like women because the prostate and breast tissue are the same. And now guys are showing up with breast cancer, which some authors say up to 3%. It was unheard of years ago. Never took place like that.
Yeah. So when we look at hormones, patients will ask me, well, I don't understand, what does my hormones have to do with aches and pains? What we now understand is that hormones sensitize or activate certain nerves. So if we activate a nerve of pain, then we're going to have pain. So if we flood the body with excess hormones that activate those nerves, now all of a sudden Miss Jones has her migraines right around her cycle. And as time goes by and she's exposed to more and more estrogen, or she gains weight, we know fat cells now produce tons of estrogen, then we see her hormones become more prolific, and then certainly her migraines too.
Now you know why we call him the professor. 888-630-9625. That's 888-630-9625. That's how you reach us here, and how you register for the class this Wednesday evening, 703-698-7117. Barbara, thank you for calling. How can we help you?
Yes, I want to inquire about the benefits, if any, of organic dark honey, such as either buckwheat or Tupero's not dark, or Manuka honey. Is there a benefit? And in particular, is Manuka better than any other kind of honey? The organic, of course.
Yes. Manuka honey is the king of all honeys, and it's one of those things that, if you can find it, it's expensive. It's extraordinarily expensive, but the beneficial effects is from New Zealand. That's one of the reasons it's so expensive, and it has tremendous healing properties. It's been around since the late 19th century. But honey generally across the board is a perfect food, particularly when you have bee pollen involved with it, and you have propolis, which is what seals a hive, and all these things can dramatically add to your overall health index. It controls inflammation. It can repair. If you get a burn, okay, and you get raw honey and you put it on a burn, it'll heal the burn. It's amazing, and it does it so fast. It's like, oh my God, really? Nature has put things out there. Honey protects against damage from all kinds of microorganisms, particularly bacteria, and it's a very sterile type of thing. It helps with infections. It helps repair the damage of inflammation, which we talked about today. One of the properties of honey is that the sugar itself is a single bounded sugar. It's not a multiple chain sugar. So subsequently, the body can handle it easier. But if you are diabetic, or if you have predispositions to diabetes, any sugar is not a good thing. And even with Manuka or local honey, if you can't get Manuka, you want to have the honey that is produced locally out in, if you're from the Virginia, Maryland area, you go out into the farms around here, because those are the best for you. If you want to treat allergies, you use bee pollen, and you start with 1 or 2 or 3 grains. It's an old homeopathic remedy to get that done. Anyway, we could talk about it forever, but the short answer is yes, Manuka's the best, and raw honey's where you want to go. Barbara, thank you for your call. Appreciate it. Tommy, how can I help you? Thank you for calling.
Hey, Dr. Roselle. I have a question for you. I've been suffering from migraine headache since 1989, and in my case, I was in the U.S. Navy going through aircrew school, and in a hyperbolic chamber accident, they blew my sinuses and called it a sinusitis hematoma. But what it really did was it ripped my sinuses from my cavity, and then it formed them back, several weeks later, real tight. And I've had problems with barometric pressure ever since. And part of my problem is behind my eye. That's where I always feel the pain, very stabbing, but only during like high pressure systems like today, for example. And I've got it right now.
Hey, Tommy, this is Dr. Browning. When you had this damage, I assume that they went and did CAT scans as follow-up of your sinuses?
Yes, I had really great ENTs that were flight medicine surgeons, and they were able to isolate it and showed exactly what it was. And behind my right eye, there's like a sinus cavity, or I guess that's what you could say. And I have a piece of tissue that every time the pressure system gets to a certain way, it fills up with blood and it blocks it off, and I can't, really valve it or change the pressure. And they've got me on Imitrex that I really hate taking it, and I don't like taking Excedrin migraine either. So I'm looking for ways other than surgery to mitigate it. Is there anything possible that you guys might be able to recommend?
Yeah, so what's happening with you is after the damage to those sinuses, you form scar tissue which becomes obstructive, and those sinuses are made to fill up and empty. Those sinuses are highly vested with blood vessels and nerves too, so depending on the change of barometric pressure, it'll cause changes like that. The bones in the face are very movable. Okay, the cranial bones, they cycle through different types of movements, including the jaw and its TMJ. So one of the first things that I think about when a person is had sinusitis or chronic sinus problems or even facial trauma is what's happening to those facial bones and what's going on with the TMJ. I know Dr. Roselle does similar type things with his practice, and I know he certainly talks a lot about the acupuncture channels that move through the face. So there's ways to drain the sinuses that way as well.
Yeah, Tommy, when you're looking at the face, you're right around the eyes and the sinus areas. There's multiple acupuncture channels that begin there or end there. So, for example, on the outer side of the eye orbit is the acupuncture channel for gallbladder. Inside is one called bladder. That's bladder 1, gallbladder 1. And then right in the middle of the eye on the cheekbone is stomach 1. So any of those areas, the eyes, the plates of the bone, all those things can be affected by acupuncture injury. So when you had that pressure, it could have damaged the entry points to those channels. Subsequently, you may even have problems with those organ systems and digesting food and the like. However, when you had that pressure and it could have collapsed millimetrically the sinus cavities, you have to bring those out. Cranial manipulation, manual manipulation, is extraordinarily effective in allowing the joint spaces, the sutural plates, to be able to move properly again. There's another treatment that we use periodically. It's called specific endonasal technique. And it's one where you can actually expand the sinuses outwards again to increase the room. But it has to be, it's applied very specifically in very specific situations. But it's worth evaluating. Dr. Browning would love to have the opportunity to talk with you and to get a little bit more data, a little bit more information. Matter of fact, if you're not doing anything, since you're in Reston, join us this afternoon and grab us after the program, and we'll sit there and we'll do a brief consult with you and see if we can find out more data.
I wouldn't be able to get there today, but I'll tell you what I will do is I'll give your practice a call. And just one quick question. Are you guys able to take TRICARE Prime?
What we do is each individual insurance is different than others. So what we do is we find out your first treatment, your evaluation. You get if you walk in our office for your first visit, you get 2 visits. First one to evaluate you completely. Second to go over findings. And at that point, whether or not you accept care, you'll know whether your insurance is covered or not covered, how much they cover, what they do. So that's not a problem. Matter of fact, come to this Wednesday evening's program, and
I absolutely will.
And talk to Dr. Browning. You actually have an opportunity to do it for a very, very reduced opportunity with a donation to Caring for Others. Tommy, thank you very much for your phone call. I think that there may be a way of at least helping your problem far better than what it is right now. 888-630-9625. That's 888-630-9625. Love to talk to you on any subject. This Wednesday evening, Dr. Harlan Browning will be your presenter, your host at the Roselle Center for Healing. He's going to be talking about headaches of all kinds, the type of pressure headaches that Tommy was just talking about, to biochemical headaches, hormonal headaches, things that can be resolved. I haven't seen a headache yet that can't be modified unless it's a space-occupying situation from a tumor or something like that. And that represents less than 1% to 2% of all types of symptom headaches. So you need to know and distinguish that and realize that you don't have to take medications for the rest of your life, that there is a way out. Join us this afternoon as well at the Angelica Film Center in Merrifield. You have the opportunity to talk to me and Dr. Browning. Our staff will be there. We're going to be presenting the Ageless Health PBS twice Emmy-nominated award special. We'd love to have you there as our guest. We'd love to see you. You got to spend $10, and it goes to caring for others. It's a 501c3, so it's fully tax deductible. You got to write it off on your income taxes. You will get a receipt, but we're going to be there, and I'm going to open it up. I'm going to present it. I'm going to tell you what the video's about. It runs an hour. Afterwards, we're going to be there. I'm going to close it. I'm going to take your questions. We'll try to be as precise and specific as we possibly can. Join us this afternoon, 2 o'clock, Angelica Film Center in Merrifield. Got a minute coming up before we have to take a break, Dr. Browning, so let's talk a little bit real quickly about, since January is Thyroid Awareness Month.
Is it?
It is.
I didn't know that.
I just saw it behind you on the monitor.
Oh, really?
Yeah. And so give me a couple classic considerations of thyroid problems when it comes to headache, because you have an inflammatory. You got 30 seconds.
Well, the thyroid is responsible for controlling a lot of the metabolism that goes in our body. And that goes above and beyond just losing weight. It has to go with each cell's metabolism and the way that they run. So certainly if people who have thyroid problems will be tired or put on weight, but very often their complaint might be a pain syndrome. Usually low level, but usually consistent and always there. So a person who has kind of a headache that comes and goes, it's not the end of the world, who's put on a little bit of weight, maybe he's cold.
But it's there.
Yeah.
Hold that thought. We'll be right back.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio, 888-630-9625. That's how you find us here in the studio every Sunday. And if you want to talk to us when we're not here, all you have to do is call our office at 703-698-7117. That's the same number that you're going to register for this Wednesday night's presentation with Dr. Harlan Browning. He's going to be talking about headaches. If you'd like to send us a note, go to rosellecare.com. That's ROSELLECARE.com. And we answer emails very, very punctually. And if you'd like to talk to one of our staff members about a specific situation, you can handle that as well. Call us. We're all in for you, no matter what the topic happens to be. 888-630-9625. This Wednesday evening, 7:30, the 21st of the month, Dr. Harlan Browning is going to be talking to you about the things that make your head explode. You know, when you feel that knife in your head, when you feel that vice around you. You know, Dr. Harlan, think about this. Think about a headache, right? We went to Northern California this fall in September, and there was a castle that was brought over from Europe. The cost of the materials many, many years ago was $44 million. It is an exact duplicate. It's called Castillo de Amorosa. And they had a torture chamber in there. And I don't know why I'm thinking about this, but they had a skull crusher, right?
Right.
And they would take people, they wouldn't totally crush their skull, they would take it to the place where they make their head feel like it was going to explode. And then if they didn't respond, they'd kill them. But that was neither here nor there. It was just about headaches. I don't know what that has to do with anything. 888-630-9625. Let's talk about what you're going to be talking about Wednesday evening.
Well, if you've ever been to one of my talks or seen me do seminars, I'm a big fan of explaining the why behind things. So I like to talk about the anatomy and the physiology, the way the nervous system works. I break it down into, 6 or 7 typical headache patterns that we see, everything from the migraine to the cluster to the tension to the hormonal to the toxic. We talk specifically about the signs and symptoms. We talk about how we figure that out, how we diagnose it, how we conservatively treat it. We're going to certainly talk about things that people don't talk about in medicine. We're going to talk about chiropractic. We're going to talk about acupuncture. We're going to talk about different types of laboratories that do unbelievably cool functional testing to see how healthy we are, stuff that you will not see in your medical doctor's office. We're going to look at hormones and their impact, and then we'll pull it all together and talk about, how are we going to fix the person, how we get rid of their headaches, but more importantly, how do we make them healthier? I said earlier in the day, our job is to make people healthier. If we do that, people get better. I don't care if it's a headache or back pain or digestive problem. We get them healthier. We change habits. They get better.
If you don't change the why behind things, nothing ever goes away. It just reappears in a different format. When we sit and we talk to our patients and we tell them, look, there's only 3 things that can cause anything. Either there's an injury or a structural aberration, something that's insulting your mechanical system. There's dietary patterns, things you eat you shouldn't eat, things that you need more of you don't get enough of, environmental toxins and irritations. And then in addition to that, you've got the emotional, the stress and strains. We internalize. We're a great culture of internalizing junk, and we keep it and we eat it and we fester on it, and pretty soon all these things working together cause these symptom processes. So if you don't learn to ask the question where something's coming from, and then even if you find out, if you're not willing to do something about it and really shift, nothing ever goes away. It just gets covered up by the medication, and then over time it begins to fulminate, and then that's when you see the blatant degradation of pathology that destroys the body.
Yeah, and then unfortunately people taking seizure medications for migraines is very common. They're taking the Advils, they're taking all these things, and those have a side effect, and that can break down the body further, and the likelihood that they come off of those things and be normal is less and less as time goes by.
Trust me, Dr. Browning will make this so simple and so applicable that to miss this program, if you have any kind of headache, migraine, anything that makes your head go thump, is silly on your part. It's time to get off the stuff. Join us this Wednesday evening, 7:30 at the Roselle Center for Healing. Dr. Browning, Dr. Harlan Browning, the professor, will be there laying it all out for you in very specific conditions and applications. Call us at 703-698-7117. And as soon as I leave here, I'm headed over to the Angelica Film Center to show you the TV special, PBS special, Ageless Health. Join me over there. $10 donation. Love to see you. Love to shake your hand. Love to meet you. We'll see you within the next 35 minutes or so. Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.